Some health news for you this morning, all about hospital wait times. A report that was just released minutes ago today shows us the best and the worst provinces in terms of waiting times for some key procedures. It's all from a survey done by the Canadian Institute for Health Information. Joining me with more is the Institute's Vice President of Research and Analysis, Jennifer Zellmer. Jennifer, thanks for being in here today. This is let's just to characterize for our viewers the significance of this. This is a first. Why?
It's a first because really there's more information now about wait times than there's ever been before. And so in this report we look not just at wait times for surgery, obviously very important, but also at all of the other steps along the way. So if your grandmother needs a hip replacement, you probably also got a visit with a specialist, some tests. So looking at those waits matters too.
And we have this data because for the first time we can talk about benchmarks in this country, correct? Just a little bit of context to this.
Sure. So there were some benchmarks set in December of 2005 that provide sort of times between when a patient is ready for surgery and has made the decision to go ahead and the surgery itself. Right. So that's that part of the wait. Set
upon by the First Ministers when they agreed to that back in 2005. And so these are the results we have as a result of your study. Let's talk about the best provinces. I know that there are some discrepancies across the country. Here are the provinces that fared the best. Can you tell me a little bit about where waiting times are the shortest?
Sure. Well, one of the interesting things that we found is that really there's no average patient and there's no average wait. So some provinces do indeed have shorter wait times than others. Okay. So if you're looking at something like radiation therapy, BC, for example, has long reported quite short waits.
1 week, as we can see in their report. Joint replacement, the best is PEI.
And one of the interesting things that we also find, take joint replacements as a classic example, is that those are average wait times, but we see some patients who have very short waits, others who wait much longer. So that was one of the other interesting things we found in the report.
And for bypass surgery, for those with cardiac needs, New Brunswick has the shortest wait time of just 8 days. Now to the worst. Let's talk about the provinces that have the longest waiting times. And again, we're going to show our viewers graphically just where the waiting times are the longest. For radiation therapy, Ontario and PEI, largest and smallest provinces.
Well, the interesting thing about Ontario too is the range, which is showing on the screen. So for some types of surgery, for some places in the province, wait times are very short. For other types of surgery, other parts of the province, they're much longer. So that was also one of the things that we looked at in this report.
And for joint replacement, again, a range in Nova Scotia up to 270 days, and Saskatchewan up to 365 days, a full year to wait for joint replacement. That's the longest waiting list in the country.
Well, and we also saw that, about 10% of patients across the country wait 14 months or more for a joint replacement, but half are treated within 4.5 months. So it's that range again.
That full range. So when you look at the wait, is it for the initial appointment to see the specialist? Is it for the surgery itself? Or what are they waiting for?
Well, those waits that we were just looking at are primarily for the surgery itself. But one of the things that we found, take again hip and knee replacements, 30% of the total time between when you're referred to a specialist by your GP and the surgery itself actually happens before you even see a specialist. So that's one of the reasons why we wanted to look at all those points along that journey.
And then, have there been, though, since we began talking about benchmarks, particularly critically since December, have there been some success stories in some parts of the country that your study has revealed that have succeeded in shortening those wait times?
You know what, there's some great examples, actually. So Toronto East General Hospital, for example, looked particularly at lung cancer. And the time between when there's a suspicious x-ray and when you have a definitive diagnosis, so when you actually know what's wrong, they were able to shorten that time by 71%. By looking at basically how do patients flow through the system? What are the steps that need to take place?
And Alberta as well, in some of their...
Alberta's done some great work for hip and knee replacements. And again, looking at making sure that when you first visit a specialist, they have the information that they need. So you don't have to come back, so that the decision can be made at that point in time.
So as we look then at these numbers and these facts and figures for the first time, this comprehensive study, where does it go from here? We have a relatively new government in place. What do you want to see done as far as health policy flowing from these statistics?
Well, I think the first step, there's big policy decisions being made right across the country. So we wanted to have a baseline about what does the situation look like today. It's really hard to plan for the future unless you know where you're starting from. So that's also what this report is about, as well as sharing some of those great stories, the examples where people have really made a difference, to see, hey, is that something I might try here?
How would you overall characterize the situation in Canada as far as, are we waiting too long for some healthcare services?
Well, I think the information about wait times has certainly improved. When you ask patients about whether their waits were acceptable or unacceptable, 7 in 10 at least, depending on the type of surgery you're looking for, say that their waits actually were acceptable. But more likely to say it's unacceptable for specialist visits than for surgery, interestingly. So, and the waits overall have been about the same for the last several years.
So they haven't increased?
They actually no. So polls suggest, lots of people think they've increased,
that's
but when you
perception.
actually ask people who've had care, how long did you wait? They've been about the same since 2001.
Fascinating peek at something we talk an awful lot about. Jennifer Zellmer from CIHI, thanks very much for joining us today. Let's head back to Halifax now. Colleen is there looking at sports highlights from last